Welcome in or welcome back. It's Kirsten. And in today's video, we're going to talk a little bit about fibroids. So fibroids may be more common than you realize, and you might not know whether you do have a fibroid. So what are the symptoms of it? So first off, fibroids are very common and they affect about 80% of women at some time during their life. And that may actually be a little bit low because many times the fibroids are asymptomatic. We don't even notice that we have them. So people are not seeking care for them and therefore they're not diagnosed. So that number can be actually quite a bit higher. And what are they? Well, they are benign growths within the uterus. They very, very rarely turn into anything cancerous or any concern. And they are within the wall of the uterus. They can sit just outside of the wall of the uterus, or they can sit on the inside of the uterus and kind of going into the uterine cavity. And you can have more than one. Oftentimes there's smaller little fibroids and then a larger fibroid as well. And they can go all the way from a seed all the way up to a grapefruit or larger. And of course, when you have a larger fibroid, you're going to have more symptoms. So what are the symptoms? How do you know whether you have a fibroid? Well, the most common one is heavy bleeding. And of course, these symptoms are going to be dictated by what type of fibroid you have. Like I said, on the outside, within the wall of the uterus, or on the inside, or multiple ones. And so when we have a fibroid that causes that bleeding, you can actually become anemic because you're bleeding so much. You're having a cycle that lasts longer than a week. Some of my clients will be bleeding for 4, 5, 6 weeks. They bleed for such a long time. Or you may also have a very heavy period, and then you're getting spotting between your period as well. So one of the risks is that we actually have low levels of iron and start to feel fatigued from that. And another very common one is just feeling like you have to go pee more often because that fibroid could be putting pressure down onto your bladder. And so you feel a sense of urgency, and therefore you might actually be going pee more often during the day and at nighttime. Another common one, again, if it's quite large, the fibroid, you may actually feel heaviness and a discomfort in your lower abdomen. And it may actually be affected when you're having intercourse. You may feel sort of a deep achiness in the lower abdomen. The man doesn't feel it. They don't know the difference. It's just you'll feel this achiness in the lower abdomen. And other quite common ones are you may feel some back pain, you may feel discomfort going down your legs, and you may actually be constipated, or you may have sometimes difficulty in avoiding the bladder. If it gets to that stage, that's somewhere that you really need to go see your GP about, because we don't want to have any of these risks where we start to have retained volume and not able to void your bladder properly. So how are they diagnosed? Most commonly with an ultrasound. So you would go to your healthcare provider. They would give you a requisition to then get an ultrasound. And they can be seen also on things such as MRIs or CT scans. Sometimes even you can palpate the lower abdomen, so feel the lower abdomen, and you'll feel a mass there, you'll feel a lump there, or the doctor can feel that when they're doing a pap test. And that's sometimes how they're diagnosed as well. So when do they occur? Between the ages of 30 and 50, usually because they are very affected by hormones. So by the time we go into menopause, which is sort of 51, 52 most commonly, then our hormones are going down, and they can even shrink the fibroids by not having that hormonal kind of drive in them. And also they can be affected by pregnancy too. Sometimes they can grow a little bigger during the first half of pregnancy, and sometimes they don't. So they respond to different levels of hormones. And what else they respond to is a sort of a bad diet where we have a lot of processed foods and have really highly salted foods. We have high levels of refined carbohydrates like white bread, white rice. We have high levels of refined sugars, such as those candy bars, and eating a lot of candy. Alcohol as well. So alcohol is one of the one of the dietary foods that we're actually really concerned with if you are having a lot of symptoms of fibroids. So if we can drop down that sugar level, because the sugar levels will affect our hormone levels, and sugar creates inflammation in our body. So we want to drop down that refined carbohydrates, drop down some of those sugars, try not to eat such highly processed foods and processed meats. Sometimes soy can be a factor too. Some people, if they're more sensitive to soy products, they could, if they're eating a lot of soy foods, there's studies that show that soy can influence fibroids. Also highly salted foods as well. And some people are saying now, when I was doing my little research before this, red meats. And I believe those saturated fats, because they can be inflammatory to some people. But I think the most common ones really are the sugars. And if we can drop down those sugars, those inflammatory foods, then we could probably be more comfortable around the fibroids. The biggest thing is that the sugars are now shown to actually begin that fibroid sort of process or grow the fibroid. So we don't want to be on a high diet of processed foods, processed sugars, processed carbohydrates. What can we be eating? Of course, lots of really healthy fish, healthy chicken and meats, those types of things, and lots of fruit and vegetables and good grains. Those foods help to drop our inflammation, helps to manage our hormones a lot better. So those couple of things really help with the fibroids. So, and also just give us lots more energy. And of course, some people too suggest to do exercise and do stress management. But at the end of the day, they don't really know exactly why some women grow fibroids and some women don't. There definitely seems to be a genetic factor. So if your mom and sister have fibroids, chances are you may have fibroids, but there's not an exact cause for these fibroids. It's just that they're influenced by these certain things, like the hormones, like the inflammation, like your diet, and maybe stress, maybe exercise. And dropping your stress and doing some exercise may help, but they're not absolutely sure. I hope that explains a little bit about what fibroids are, some suggestions on how to treat them, ways that you can get yourself checked whether you have them, and then what do you do about them afterwards? Well, it used to be that women would get a hysterectomy because we finished having our babies and, well, we don't need that uterus anymore, and just cut it out. But we're not doing that as often. There's medications that we can utilize. There's hormone medications that we can utilize. Sometimes they'll do a myomectomy where they'll take out a larger fibroid if it's one of the ones that they can do surgery on. And also someone are saying, okay, well, I don't really want to have a hysterectomy and I don't really want to have surgery. So maybe I'll manage those other factors that we talked about and see whether they can not grow bigger. Maybe I can manage my symptoms, and then they can hopefully start to shrink and minimize after I go into menopause. How do hormone like HRT, hormone therapies help with other things, I should say? So after you have your menopause and you might be on hormone therapy, does that affect fibroids? There's not tons of information out there, but I imagine that they're also going to be affecting the fibroids too. But remember that many of us have fibroids, and the majority of us, they're asymptomatic. We don't notice them. They kind of grow, then they go away, and then another one might grow. So there's also, imaging that they'll see fibroids in the uterus, and then over several years they shrink, and they think, oh, what have I done differently? Well, I was 30 there and I'm 35 now, so I'm still having my period. Why has it shrunk down? Again, there's a little bit of areas that we still need to work on why fibroids are happening and what are the causative factors, because it seems like there's still a lot of uncertainty around them, but they do know that there's factors that can make it worse. So I hope that helps. And if that does help, and let me know down below if you have a fibroid. Comment down below, because I think that a lot of women don't realize. They think, oh my gosh, I have a fibroid, what is this thing? And they don't realize how common it is and how many of us actually have fibroids and often have the symptoms too. So comment down below. I'd really be curious to see whether you have, how many of you have fibroids. And of course, you can like this video and subscribe. Okay, all the very best. Take care.